Good morning, everyone, and welcome to the National Hispanic Council on Aging's webinar on brain health. My name is Christine Perez, NACOA's Director of Program, and it's my pleasure to moderate today's webinar. So, June is Alzheimer's and Brain Awareness Month, the perfect time to review helpful and accurate information about brain health, how to maintain good brain health, and what new research and policies are especially relevant to brain health. The Latino community faces disproportionate impact across most issues of public health, and community events like this webinar serve to ensure that important information is accessible and available to older adults, their families, and caregivers. Before we begin, let's take a moment to thank today's event sponsor, AARP. So to begin today's discussion, it's my pleasure to introduce Dr. Janita Cruz, the President and CEO of the National Hispanic Council on Aging. She's one of the nation's foremost advocates and spokespersons for diverse older adults and has been recognized for her commitment and leadership on behalf of diverse older adults nationwide. Welcome, Dr. Cruz.
Good morning. Thank you, Christine, for your kind introduction, and thank you for moderating today's webinar. And thank you to everyone for connecting this morning from across the country and I'm sure from other parts of the world. So I'm pleased that we are connected and gather here today to address such an important issue, which is matters connected to our brain. So thank you for connecting for this important conversation that continue to promote healthy aging and community well-being. So thank you. And of course, keeping your brain healthy is a big part of our wellness and overall functioning as we get older. Our brain health influences our ability to learn, our ability to remember, to make decisions, communicate, and engage with the world around us. These abilities are essential to keeping our independence, staying connected with our loved ones, and enjoying a high quality of life as we get older. And as the Latino population continues to grow and age, it is very important that we emphasize education, awareness, and access to trusted and reliable information so that our community can do its best to manage good brain health. And we know that too often we engage in conversations about cognitive health, memory loss, and conditions such as Alzheimer's disease only after challenges emerge. We are forced to be reactionary in our care rather than focus on prevention. And we believe that by raising awareness and encouraging proactive approaches to brain health, we can help our communities better understand risk factors, recognize early signs, and seek support when necessary. And I'm delighted that today's webinar is part of NACOA's ongoing commitment to empowering our communities with culturally relevant information and science-based information and resources. We are convinced that knowledge is among the most powerful instruments at our disposal for promoting prevention, encouraging healthy behaviors, reducing stigma, and connecting people with the support services available to them. Today's discussion is for you, is for older adults, is for caregivers, for health professionals, and community leaders. We hope it will provide useful information and practical tools that you can take back home, back to your families, back to your community, and to all the older adults in your lives. So please help make sure that your community has the right information to make good decisions. informed decisions. And so before we continue and before we get to hear our, from our amazing panelists of experts, I want to just express my gratitude to all of them, to all the panelists who are here with us today. They bring a wealth of knowledge, a wealth of information, but more importantly, they bring heart. They want to make sure that our community, that our nation, that our world is well informed with this important information around brain health that will keep us healthy. So thank you to our panelists. Thank you for the partnership, and thank you for all you do to make our nation healthier. So with that, Christine, I turn it over to you, and thank you for connecting.
Thank you, Dr. Cruz, for your welcoming remarks. So let's begin with our panel session. So brain health is an essential part of our overall well-being. It plays a critical role in how we think, learn, remember, and connect with others. As we age, taking care of our brain becomes increasingly important. But let's hear more about this topic from our first speaker, Dr. Juan Rodriguez, Vice President of Brain Health at AARP, where he leads the organization's work on brain health, advancement, and dementia risk reduction. Dr. Rodriguez also served as Executive Director of the Global Council on Brain Health, an AARP-led collaborative of internationally recognized scientists and clinicians that translates emerging research into practical guidance for the public. Today, Dr. Rodriguez will provide an overview about brain health and relevant AARP resources. Welcome, Dr. Rodriguez.
Thank you so much, Christine, and everyone for having me. I'm thrilled to be here today to talk to you a little bit about brain health and specifically what brain health looks like in Hispanic populations and why it's of particular concern for us. Next slide, please. We can go to the next slide. All right, so I'm an epidemiologist by training, so I will focus. I'm going to focus a lot on numbers because that's the language I speak mostly. But the Hispanic and Latino population in the U.S. is the largest and the youngest minority group in the country. We make up over 68 million people and about 20% of the population. This map is from the Census Bureau, and you can see these are counties in the United States. And the darker the blue, that means the larger the Hispanic population. So the darkest blue counties are counties where there's 50% or more of the population in that county is Hispanic. So you can see that while we're one of the largest minority groups in the United States, we're not equally distributed across the country. We tend to live in pretty specific places, but that is spreading. Particularly, there's an increase in population in rural America of Hispanic people. Next slide. Sorry, next slide. However, the Hispanic population is also the fastest aging population or demographic group in the United States. These are called population pyramids, and the bottom of the pyramid is younger ages, and the top of the pyramid are older ages. And you can see in 2020, you can see the shift from 2000 to 2020 as the Hispanic population is getting older, the pyramid is getting wider on top. So we might be the youngest demographic group, but we're also the fastest aging population in the United States as well. And this is especially important as we think about brain health and neurocognitive diseases like dementia. Next slide. There are approximately 7.5 to 8 million Hispanic adults aged 50 to 64, and an additional 5 million that are aged 65 or older. These groups are mostly composed of those who immigrated to the US in the 1980s and 1990s, unlike the younger Hispanic population, which is mostly composed of US born individuals. The number of Hispanic adults aged 65 plus is expected to nearly quadruple, and it's estimated to reach over 20 million by 2060. Next slide. But we do see for aging for the Hispanic population, we do see an interesting paradox. Immigrants, just by virtue of being healthy enough and young enough to move to the United States, be able to work, make a living, start afresh, our immigrants tend to be younger and healthier. However, the longer you live in the US and the longer you are at age of arrival, the greater the health risk for immigrants. The health advantage of immigrants is often gone once you start looking at people over 60 years of age as they adapt to their new home. So we see in Hispanic population specifically, once you hit age 60, we see higher rates of chronic disease and we see greater limitations in physical function. But the paradox comes in when because we have greater life expectancy than other groups. And so this to me points to a healthy aging issue, and particularly one we have to think about for brain health. Next slide. Approximately 13 to 14% of Hispanics aged 65 and older are currently living with Alzheimer's. That's over 600,000 people. Hispanic adults aged 65 plus are 1.5 times more likely to have dementia as white older adults. Studies suggest the Hispanic population may also tend to develop symptoms at younger ages than non-Hispanic whites. Hispanics will face the greatest increase in dementia cases of any racial or ethnic group in the US, and it's projected to have over 3.5 million cases by 2060. Next slide. What drives that increased risk? I structured these into two buckets. The first are the cardiovascular and metabolic links to dementia. Hispanic adults are nearly 2 times more likely to be diagnosed with type 2 diabetes, and having untreated diabetes particularly is puts you at increased risk of dementia later in life or Alzheimer's disease later in life, particularly because of the inflammation it can cause. And while rates of hypertension and high cholesterol are similar between Hispanic and non-Hispanic white adults, the differences lie in care. Hispanic adults are less likely to have their condition managed, and we can see that in stroke rates. We're seeing significant increases in stroke in the Hispanic population. We've seen a 16.1% increase in stroke among Hispanics compared to a 7.2% increase in stroke among white populations. And that gives us a sense that while hypertension and cholesterol are similar rates, they're not being managed as well in Hispanic populations. And that is also driven by structural factors. Hispanics tend to have more limited access to healthcare that can impact early preventive care and diagnosis. We have lower socioeconomic status overall. That means less access to resources and education. And there are differences in social and physical environments. For example, greater exposure to pollution, adverse childhood experiences, and less access to grocery stores where you can get healthier foods, parks where people can get physical activity in a safe way. And so these two buckets are the prevailing theory on what drives this kind of this 1.5 times greater risk. Next slide. So how do we address this increased risk? And that comes with investments in our brain health. Next slide. So I'll kind of give you a quick overview of what is brain health. A lot of the other presenters will give you a lot more details. Next slide. So defining brain health isn't the absence of disease, it's what we do to protect, build, and invest in our cognitive health. Brain health is the ability of your brain to support the mental functions that allow you to live the life you want. So that'll include thinking clearly, remembering what matters, making good decisions, managing emotions, staying engaged in relationship and activities, and maintaining independence. And it's not just an activity or something to do for older adults, it's a lifelong journey. We can take action to strengthen our brain health at any age. Research shows us that there are many things we can do for our brain health and to help us age as healthily as possible. Next slide. Our brain health is more than our cognition. It's partly our cognition, but it also includes our emotional and mental well being. It also factors into our functional independence, and it also affects our physical health. There's all sorts of factors that have to do with heart disease, with metabolic issues, with hearing, with vision, that all can affect our functioning, that can affect our emotional well being, it'll affect our cognition. Next slide. And it's important to note that dementia is not an inevitability. It's estimated that up to 45% of dementia cases may be attributable to modified disease modifiable risk factors, meaning that there's an opportunity for prevention. There's a role that prevention can play. How we live our lives has the potential to impact our risk of developing dementia, and that is expressed in how we manage our health and how we develop healthy habits, including being creatively engaged. Prevention and making healthy choices won't guarantee we'll never develop dementia, but they can reduce our risk and help provide us with better long-term health. Next slide. AARP has the 6 pillars of brain health. This is a kind of a framework we use in order to kind of help people understand what they can do in order to take charge of their brain health. The first pillar is being social and how important it is to keep in touch with friends, family. Don't let yourself get isolated. The next is getting your engaged, keeping your brain engaged, finding ways to stimulate your thinking, exploring interests and hobbies, managing your stress, practicing relaxation, adopting a stable daily schedule, and focusing on your mental health. Ongoing exercise is very important as we age. We have to keep moving throughout the day. We should target getting 2.5 hours of physical activity a week. Our sleep, very important for our brains. We need to get 7 to 8 hours of restful sleep every day. And eating right. We need to choose a nutritious, heart healthy diet of fish, veggies, and fruits. Next slide. Our physical health, very important for our brains. Managing common chronic conditions is an important part of our brain health. So high blood pressure, high cholesterol, diabetes, hearing loss, sleep apnea or other sleep issues, and vision loss have all been shown to contribute to our risk of developing dementia later in life. So it's important to keep these conditions managed and have these issues treated. Next slide. And so if you want to invest in your brain health, this is an area where AARP can help. We have tons of resources that are available to you to help you manage some of these issues. Next slide. If you want to learn more about the science of brain health, you can visit the AARP Global Council on Brain Health. The GCBH is an international group of scientists, officers, and experts who review the latest research and develop trusted evidence-based recommendations to help people maintain their brain health as they age. Next slide. They've tackled topics related to healthy behaviors like social engagement, mental well-being, sleep, physical activity, nutrition and diet, and cognitive stimulation. Next slide. Topics on medical factors like hearing, heart health, use of natural supplements, and as delirium as well. Next slide. As well as additional topics on issues like health equity and the social determinants of health, providing general guidance on how to make sustainable behavior change to develop those healthy habits, and also a report looking at the potential for music to promote brain health and mental well-being. Next slide. If you want help making active changes to your brain health, you can try Staying Sharp, and all these QR codes on these slides will take you directly to these programs. Next slide. Staying Sharp is AARP's brain health platform, offering engaging activities, articles, videos, and tools that can help people build healthy habits to support lifelong cognitive well-being. They have great content to help people coach you through making behavioral changes for your brain health. Next slide. We also have our Healthy Brain or Brain Health Resource Center. The Brain Health Resource Center brings together AARP's most trusted brain health information. Next slide. It has practical tools, educational resources, and articles, all to help people understand brain health and what you can do to try to help make changes to your daily habits. And next slide. And then finally, the AARP Hearing Resource Center. Untreated hearing loss, I think, is one of the most unrecognized symptoms or risk factors for cognitive decline. And it's very important that we treat our hearing loss. Next slide. Our Hearing Resource Center provides information, guidance, and tools on hearing health, including a hearing test, a free hearing test you can take, as well as access to discounts on hearing aids. And these are because hearing health is such an important part of brain health. Next slide. And you can also visit the About AARP page. AARP does so many things on top of brain health. We do, there's so much that's done around Social Security and Medicare, affordable housing, all sorts of topics. So if you please check out the additional services and programs AARP offers. All right, next slide. All right, thank you so much. Thank you for having me and appreciate the time.
Thank you, Dr. Rodriguez, for that wonderful presentation and also for sharing such useful and educational resources available through AARP. So, as we continue, please be sure to hold on to any questions you have during today's discussion and type them into the chat box. At the end of the panel session, we will have a question and answer session where we will have the time to review all the questions within the chat. So, maintaining brain health is key to healthy aging. Incorporating healthy habits into our daily lives, such as regular physical activity, good nutrition, and a healthy sleep schedule, can help support brain health, just as Dr. Rodriguez mentioned. So, our next speaker is Dr. Jackie Quiroz, a professor of psychological and brain sciences at Boston University, where she leads the Multicultural Alzheimer's Prevention and Protection, also known as MAPP Lab. Today, Dr. Quiroz will speak on her research into Alzheimer's disease and also highlight tips on how to maintain good brain health. Welcome, Dr. Quiroz.
Thank you. Thank you so much for the invitation. And I'm going to follow with actually a lot of the points that I want to emphasize. It's great that Dr. Rodriguez already introduced them. So my name is Jackie Quiroz, and I'm the director of the Multicultural Alzheimer's Prevention and Protection program or lab at Boston University. And I am a clinical neuropsychologist as well at Massachusetts General Hospital. Next. So I'm gonna start giving you like something that probably many of you already know, but I wanted to make sure that everybody's on the same page. And we're talking about Latinos, or in general, Latinos, we are a very heterogeneous group. So we share many things, but there are also things that are different. So the culture has some differences in terms of immigration history. There are generational differences as well. Everybody has a different experience with discrimination or trauma. And there are several differences as well in education and economic challenges. So that's the first thing that we consider when we are actually doing our work. Next. Our work is with the Latinos in the US, and this is also just to provide you an idea of who are the Latinos that live in the US. The majority are originally from Mexico, with a background from Mexico, but there are many other countries that are represented in the Latinos in the US. And interesting, like something that we started doing in my group, it was also including Brazilians and as part of the what we call Latinos, because we share the Latino American background as well. Next. So one of the considerations that we have, and as you probably also know, is that we share many of us share the language. We share Spanish or English, and as I was saying in Brazil, Portuguese. So languages is also a plus, and it has been shown that being bilingual, for instance, can actually have some protection for brain health. So we always ask, how many languages somebody speak, and also we leverage that to assess cognition and cognitive decline in the language that is preferred by our participants and our patients. So we go after the culture, and we actually think that culture is something that we should be very proud as Latinos, and we leverage that to actually get access to communities and Latino communities here, particularly in Boston. Next. So in 2018, we actually started this program that is now called MAP. We started at the Massachusetts General Hospital, and it was this idea of having a cultural approach to dementia prevention, considering everything that I just mentioned in terms of Latinos, and see what we can do that is relevant for the Latino communities, including the different subgroups that are there, the different languages, and also the similarities in terms of culture. So you can read more if you are curious about the approach, but this is a publication that we had back in 2022 where we outline everything that I'm going to be just briefly mentioned next. Next. No, the previous one, sorry. Can you go back? Thank you. So we are talking about dementia, and this is something that I hear a lot, that sometimes we get confused between dementia and Alzheimer's disease. I think that it's important to know that dementia is an umbrella term, and this is actually taken from the Alzheimer's Association fact sheets. So Alzheimer's disease is only one type of dementia. It's the most common etiology, the most common cause of dementia, but there are several others, including Lewy body dementia, vascular dementia, frontotemporal dementia, and mixed dementia. That is when they have more than one etiology. So Alzheimer's disease is, as I said, the majority of cases, and as Dr. Rodriguez mentioned, like the Latinos are actually an increased risk to develop a dementia. And next. So we actually have about 1.5 times a greater risk to develop Alzheimer's disease and dementia. Dr. Rodriguez mentioned some of the possible explanations for that, but the truth is because Latino has been understudied, underrepresented in clinical research for several decades, most of what we actually know about Alzheimer's disease risk is actually something that we learn from non-Latino samples. So I actually think that we are still trying to understand why we are at greater risk and what exactly are the factors that are contributing to that health disparity, for instance. Most important, I actually think that that we need to be more conscious about what it works for us, and this is something that we are adapting, in particular in our work. Healthy eating, for instance, is something that is very standard. We hear a lot about eating healthy, but how do you actually go about eating healthy when you're actually eating the foods that we like? Understand, like, I'm originally from Colombia, for instance. It's kind of like, if you actually ask me to stop having my arepa every day, it's going to be a challenge, but we actually find ways to use the ingredients to actually make it more relevant for our culture. Next. So the Lancet Commission in 2024, and also Rodriguez also mentioned this, identifies some modifiable risk factors. So there is a major risk factor of Alzheimer's disease, that is the genetic factors. We cannot change that part. But there are about 45% of risk to develop Alzheimer's disease that is actually explained by modifiable risk factors. I don't know if you can actually see it that well here, sorry about that, but there are some early life factors like education, several factors that have been identified in midlife, including like depression, physical inactivity, diabetes, smoking, obesity, and some factors that are more linked to late life, including social isolation, air pollution, and visual loss. That is also something that is impacting this risk. So keep in mind that 45%, because it's an opportunity for us to actually reduce that risk and pretty much prevent Alzheimer's disease as well. So next. So this is an adaptation also, is something that Dr. Rodriguez mentioned. These are like 5, he mentioned 6, but it's also 5 or 6. The first one that I always like to highlight is the activity. The physical activity is one of the ones that has been shown a lot of evidence that actually help your brain. So I always tell my patients to get moving or keep moving as much as they can. So I mean, like, if you like to go for a walk, go for a walk. But if you cannot move and you're in a chair, try to find something that you can move your arms, your legs. The important thing is that you actually bring in that blood flow to your brain, and that's definitely making a huge difference from your brain health, and especially for your memory. As I was also mentioned before, eating right, eating healthy, trying to make an emphasis on veggies is also important. Sleep well, as it was mentioned before, and related to what we eat and the physical activity, like trying to keep your healthy weight. That's something that is linked to not just Alzheimer, but many other risk factors as well. And smoking is one that, as mentioned before, also increase the risk. Next. So something that is important to keep in mind, and I agree with what Dr. Rodriguez mentioned, is like any day, it doesn't matter like how early, how late you start, you can start doing things to protect your brain and to improve your brain health. If you are 20, you are in your 20s or 30s, start. And if you are 80, so you can start. It's always a good time to start, especially because all of these changes that you make in your daily life, they're going to have an impact in how you live in the future. So the first one here is challenge your mind, and that's kind of like pretty much keep your mind active and stay mentally active. The second one is more about learning. Try to learn something new. This is here, stay in school. It doesn't mean like staying in school like a formal education, but learn something new. If you like to learn music, learn a new musical instrument. If you like to learn a new skill, the important thing is that the brain needs to do some exercise, and learning definitely helping to get more active. The next two actions are pretty much something that we can do in collaboration with our primary care doctors. Like it's important to keep control and the blood pressure and the diabetes as well. Like that's something that is not just like how healthy we eat and how we keep our weight healthy, but also like is you actually need medications to control your blood pressure and your type 2 diabetes. See how you can actually get a better care and better management of these risk factors. And the last one, that is something that sometimes we forget, especially as we get older, is kind of like protect your head, right? Like try to protect it because we don't want to create an injury, having an accident that can be prevented too. Next. So in the last couple of minutes, I'm going to tell you more specifically about what we are doing here in Boston. So in 2018, as I mentioned, we started with this idea of the multicultural program. And as part of that, we created a couple of research studies to open the door for Latinos to participate in prevention research and also in Alzheimer's disease research. So the first one is the Harvard Aging Brain study that we started the Latino Hubs. And in 2019, we created the Latino Aging Registry that opened the door to anybody that is older than 55. And in 21, we got a grant from the NIA that allowed us to add biomarkers to the project. And we include blood biomarkers, neuroimaging, and other biomarkers as well. And then in 2022, we merged all the projects together, and that now is the Boston Latino Aging Study as well. Next. So this is just a summary of what we have. As I mentioned before, so we followed a longitudinal study of older people older than 55, and they self-identify as Latino, having a Latino background. They can be Spanish speakers, Brazilian Portuguese speakers, or monolingual or bilinguals, and these are the procedures that they get. Next. Just briefly mention something that we are doing that is a little different from the more traditional research studies, that we're actually giving back to the participants the results. So when they actually have neuropsych testing or cognitive testing, we give them a one-page report of how they did. So if they actually need to follow up with clinical care, they can do it. We also give them the results of the blood samples, especially looking at clinical markers. And other than that, we actually created optional procedures. So it's up to them if they want to continue in the study or no, for like how many sessions is not required to do all the procedures. So with that, next. So yeah, so this is pretty much what we have now for the Boston Latino Aging Study. But like, as I mentioned before, putting everything together. And next. yeah, in case that you want to learn more about this. So yeah, as I mentioned, we have in English, Spanish, and Portuguese. We also have a remote auction because we have received several inquiries about Latinos living in nearby states that are not necessarily in Massachusetts. So we have a sub-study that is open for everybody in the U.S., including Puerto Rico as well. Next. We have so far a little over 300 participants, including both Spanish speaking and Portuguese speakers, and these are kind of like the countries that are represented. Next. So what we have learned, and I wanted to share this because the same, as I mentioned, we started in 2018, so it's less than 10 years that we are doing this in Massachusetts. But we have been able to do it through the partnership with the community and the partnership especially with the senior centers and the community organizations here in Massachusetts, as I mentioned. So we have now a very established partnerships and collaborations with them. We go to the community and we educate and provide education in Spanish and in Portuguese to these communities, and we try to do, as I mentioned, including the option of participating in research and something that they see us every week or every other week. So if they don't want to do it right now, they know that we are there as an option for them in the future. Next. Yeah, these are just some examples that we are pretty much with the community. And the radio is another thing. We are in the local radio at least once a month, sharing information about brain health and Alzheimer's disease. Next. And with that, I just wanted to thank everybody in my group, and especially the research participants and families. And next. With that, thank you very much.
Thank you, Dr. Quiroz, for your presentation and also for sharing such valuable tips for good brain health and also carrying out such important research to advance our understanding of Alzheimer's disease and also improving brain health outcomes. So, as a reminder, please feel free to write your questions in the chat box until our question and answer session at the end of today's webinar. So, to better understand the experiences, challenges, and needs of Hispanic older adults and caregivers affected by the Alzheimer's disease, NHCOA conducted a series of focus groups to gather valuable community insights. Let's hear more about this topic and its findings with our next panelist, Cristina Pacheco, NHCOA's Director of Research and Resource Development. Today, Ms. Pacheco will provide an overview of NHCOA's Alzheimer's focus groups and their results. Welcome, Christine.
Thank you, Christine. And thank you for the opportunity to share these findings. Today, I'd like to share what we learned by listening directly to Hispanic older adults, family caregivers, and healthcare providers about Alzheimer's disease. We know that Latino communities are disproportionately affected by Alzheimer's disease, with them being about 1.5 times more likely to develop the disease, yet they are less likely to receive an early diagnosis. And we wanted to understand why, what people know, what barriers they face, and what opportunities exist to improve brain health in our communities. To answer these questions, we started by listening. Next slide, please. This project brought together 3 perspectives: older adults, family caregivers, and healthcare providers. We conducted focus groups and interviews in Washington, D.C. and 3 communities in South Texas. Rather than asking people to check boxes on a survey, we asked them to share their experiences, beliefs, concerns, and ideas. 4 themes emerged consistently across all of these conversations. Our first theme focused on knowledge. Next. So nearly everyone in our research associated Alzheimer's with memory loss, but many participants didn't understand what causes the disease or how it progresses. Some believed that Alzheimer's developed because someone was worried too much or experienced too much stress. Providers consistently observed that families often dismissed early symptoms as just getting older, which delayed evaluation and diagnosis. And you're going to hear that a lot throughout my talk. One participant captured this perfectly. Next slide. I did know that you forget things because of age. I didn't know that people could die from it. This quote illustrates something important. Alzheimer's wasn't viewed as a progressive disease. It was viewed as an expected part of aging. When families believe that memory loss is simply what happens when you get older, they are much less likely to seek an evaluation early when diagnosis and intervention can make the greatest difference. But knowledge wasn't the only barrier. Next. Participants told us there were several reasons why people delayed screening. Fear and stigma can certainly play a role, but they also described practical barriers, limited health insurance, language barriers, financial concerns, and simply not knowing enough about Alzheimer's to recognize that there was a need for evaluation. Interestingly, providers told us that recommendations from a trusted healthcare provider often made the difference, resulting in folks getting screened. But stigma helps explain why these conversations are often delayed amongst our own loved ones. Next slide. What happens is they call you crazy. He was all right, and then suddenly he went nuts. That's an incredibly powerful statement. When Alzheimer's is viewed as going crazy instead of a brain disease, people may avoid talking about symptoms altogether. Reducing stigma is just as important as increasing knowledge. Next. Older adults and their families tend to attribute memory loss to symptoms of aging. Providers repeatedly described one challenge: families normalize early symptoms. Memory loss wasn't recognized as a warning sign, it was accepted as a normal part of growing older. That normalization delays conversations, delays screening, delays diagnosis, and delays treatment. This theme really resonated with me because I realized I am guilty of this too. My parents are 78 and 72, and every once in a while, sometimes more often, they'll forget something or they'll repeat a question that I just answered. My first instinct is not to wonder whether something might be wrong, although that might linger in the back of my head. I tell myself they're just getting older, or maybe this was a busy day and their brains are tired. I study Alzheimer's disease. I know the importance of early recognition, but if I'm honest, part of me avoids having those conversations because I'm afraid of what I might hear. If I bring it up, it could make dementia feel real. So even with all of my training and knowledge, I too have delayed conversations. That is exactly what many of our providers in our study described. It's not a lack of knowledge. Often it's love, it's fear, and it's hope that what we're seeing is just normal aging. Unfortunately, that delay can also mean delay to access for support and diagnosis. Next. So once we understood the barriers, we asked another question: what resources are people missing? And the answer was remarkably consistent. Older adults, caregivers, and our providers all described gaps in education and screening materials, caregiver support, Spanish language materials, and culturally appropriate information. That's information that goes beyond just translation and speaks directly to our cultures. Next. Unless prompted by a nurse, a caretaker, or a doctor, the elders are unlikely to seek screening. This observation highlights something important. People aren't opposed to screening. They often just need someone they trust to start the conversation. And this is where we really need to work with our healthcare providers to ask those questions, even if for them it might be uncomfortable. Next. Healthcare providers were almost unanimous in declaring that there were no culturally and linguistically appropriate Alzheimer's resources for Latino older adults in their communities. What struck me the most about this finding is that it didn't come from patients and caregivers. It came from the providers themselves. So even they recognized that there were too few culturally and linguistically appropriate resources available for Latino older adults and their families. This tells us that improving brain health isn't about awareness. It's about building systems that meet communities where they are. Those findings point us towards some clear opportunities for action. Next. Our final theme focused on our caregivers. Caregivers described emotional, physical, and financial demands of caregiving for a loved one with Alzheimer's, often while balancing their own work and family responsibilities. What stood out was that families overwhelmingly want to continue caring for loved ones at home whenever possible. They weren't asking for someone else to take over. They were asking for knowledge, resources, and support so that they could do their role as a caregiver well. And one finding really captured just how overwhelming this responsibility can be. Next. Nearly every caregiver rated their stress between an 8 and a 10 on a scale of 1 to 10. That tells us that caregivers are not simply tired. They are carrying an enormous emotional, physical, and financial burden, often with very little support. Many of us work in jobs with no paid leave, and so that also adds to that financial burden. If we want better outcomes for people living with Alzheimer's, we have to support the people who are caring for them every day. So where do we go from here? Next. The encouraging news is that these challenges are not insurmountable. The participants themselves pointed us towards solutions. They asked for earlier conversations about brain health in clinics, culturally and linguistically appropriate education, stronger communication with healthcare providers, and greater support for caregivers. None of these recommendations require a breakthrough treatment. They're meeting communities where they are with the information that they can use. Next. I'd like to leave you with one final thought. When we began this project, we wanted to understand why Hispanic older adults are diagnosed later with Alzheimer's disease. What we learned is that this answer is multifaceted. It's knowledge, it's stigma, it's access, it's caregiver support, but ultimately it's trust. Improving brain health in Latino communities will require more than medical advances. It requires listening to communities, investing in culturally responsive care, supporting caregivers, and making brain health a part of everyday conversations. Next. So research can inform policy, policy can inform systems, but real change starts around our own kitchen tables. As I close today, I want to come back to something I shared a few minutes ago. I admitted that even though I study and work in Alzheimer's disease and brain health, I still catch myself explaining away the changes I see in my own parents because it's easier to think they're just getting older. The truth is, I too have delayed these conversations, and today I'm making a commitment to change that. My hope is that each of us will do the same. Let's make brain health a normal part of how we care for the people that we love. Let's talk with our parents, our grandparents, spouses, and friends, not because we expect something to be wrong, but because these conversations shouldn't wait until there's a crisis. We have normalized conversations about colonoscopies, mammograms, and blood pressure. We remind our loved ones to get screened for cancer, diabetes, and heart disease. Brain health deserves to be a part of those conversations too. So today I'm taking that pledge with my own family, and I hope you will join me by having at least one conversation with someone you love about brain health. Thank you.
Thank you, Christina, for such an informative presentation. And also, these focus groups are an important step forward in understanding Alzheimer's disease within the Latino community, a demographic that continues to be disproportionately affected. So far, today's presentations have provided excellent context on Alzheimer's disease in the United States and also its impact on the Latino community. It affects millions of older adults and families nationwide. It is crucial for policy efforts to focus on improving access to care, supporting caregivers, advancing research, and also addressing disparities to ensure better outcomes for all communities affected by the disease. Let's hear more from our final panelist, Ms. Jennifer Polak, the Senior Director of Access and Regulatory Policy at the Alzheimer's Association and the Senior Director of Alliance Development and the Alzheimer's Impact Movement. With over 15 years of experience in policy and legislature, Ms. Polak can join us today to provide an overview about Alzheimer's intersection with policy issues at the national level. So welcome, Ms. Polak.
Thank you so much. Thank you, Christine, and it's great to be here. Appreciate everybody being here and talking about this important topic. So next slide, please. I want to talk a little bit about our facts and figures. Every year, the Alzheimer's Association puts out the facts and figures. This year was our 20th year, 20th edition. And this is where a lot of the facts and figures that are used in research as well as grant writing and things like that are come from. And so this year, it said that over 7 million Americans are living with Alzheimer's disease. Nearly 13 million Americans provide unpaid care for people with Alzheimer's or other dementia. We know that these caregivers provided more than 19 billion hours, valued at over $446 billion. In 2026, Alzheimer's and other dementias will cost $409 billion. And by 2050, that cost could rise to nearly $1 trillion. We've heard from other speakers about the impact the disease has on communities and caregivers, and these are just some of the financial impact numbers that you can see as well. So next slide, please. Thank you. This year, every year we do a special report. This year we did a special report on brain health in America. And we know that Americans do care about brain health. You can see overwhelmingly that maintaining brain health as you age is very important, and that it's at least as important as physical health, but they need support maintaining it. So they know about brain health, but not many know a lot about how to maintain brain health. Next slide, please. We also see that Americans believe that lifestyles are important for brain health. So we know that that people look at sleep and exercise and social engagement, but they don't really put it into practice. We see that especially with sleep, that it's hard for people to get the amount of sleep that they need and to put that into practice. Next slide. We also know that Americans want brain health programs. They are interested in different programs, but we know that barriers exist. Some of that has to do with whether it's at home or self-guided at home or in person or some sort of combination. Next slide. And we also know that they do want guidance from healthcare providers. We know that primary care providers are a preferred source of information on brain health. and where they can get the most information. But we also know that those conversations don't always happen. We hear brain health talked a lot about these days, but you know, over the last 10 years or so, we've really been building up to get people to recognize brain health as something that is just as important as heart health. Next slide, please. Part of what has led to brain health really becoming this knowledge base in this topic that people are aware of, or some of the work that that we're doing through CDC, through the Bold Infrastructure for Alzheimer's Act and the cooperative agreements that came out of that, which is really working with state, local, and tribal public health agencies to encourage them to promote brain health in their communities. This slide just shows a number of resources that we have, including a roadmap on healthy brains. Next slide, please. I want to talk a little bit about some of the programs the association is doing before I get into some of the policy that we are working on. So first up, we have a brain health roundtable where we bring organizations to come and talk about brain health and ways to build a broader movement to drive collective action. Next slide. We also have the Brain Health Advancement Institute, which was recently launched, that is looking at translating research, awareness and education and outreach, and ways that partnerships and system activation can work. Really connecting that scientific discovery to translation of research into tools and education and resources that people need and will use. On our next slide, you'll see that we also have programs for providers. So we have a Project ECHO for Alzheimer's and dementia care that's focused on brain health. And I'll talk about a policy that we have that looks at providing the same type of Project ECHO for primary care providers. So this one is really focused on brain health, improving clinical practice on brain health across the lifespan. And on our next slide, we have a program that we launched called Brain Health at Work. If you could go to the next slide, please. Thank you. And this is really helping employers support their employees by creating brain healthy workplaces to improve the brain health of their employees. So they complete an organizational assessment, they have a tailored resource kit, and then there's different ways to continue their commitment, but really bringing brain health into the workplace. We also, on the next slide, have a new campaign called the Rethink Your Brain campaign. And this is promoting ways that individuals can take action to improve their brain health, beginning with a 6-step challenge. You know, this is a way for folks to log their exercise, look at the foods they're eating, make sure that they're really taking brain health into account throughout their lives. Just a few more resources. We have the Brain Health Habit Builder on the next slide. And this is something that you can use on your phone and check your habits, get your personalized results, and build out an action plan for yourself. And then we have on the next slide, the 10 healthy habits for your brain. So these are things that, you know, seem like things everybody knows, right? Control your blood pressure, get moving, don't smoke, manage diabetes, eat right. But other things like protect your head, wear a helmet if you're biking or skateboarding or riding a scooter. You know, we know that sleep is so important for brain health. And so making sure that there are positive everyday actions that individuals can incorporate into their daily lives. On our next slide, you can see that we are providing research-backed guidance to help educate. So we do this through a volunteer-led capacity, and we have our online and Spanish versions that are coming soon. But it's a 15 to 20 minute awareness presentation that you can do in your community, community gatherings, in workplaces, to talk about the importance of brain health in your community. And then I think the thing that has really driven us on the next slide is this slide, thank you, is the US Pointer trial. This was a long-term study or 3-year study that really looked at lifestyle modifications that you can make. And at what point does that actually impact brain health? And it turns out it does impact brain health. Healthy eating, sleep, all of that really does impact brain health. And so we've done this control trial. Now we're looking at implementation science. And so we have an alumni extension study. We're also investing in implementation studies and tools to develop tools for communities to support implementation. And so you will see there's a request for proposal coming soon on community programs to better implement the learnings from US Pointer. And this next slide shows the multi-level public health approach. So we know that public health comes in multiple ways through individual knowledge and skill. You can click forward. I think it might have a little bit of animation on here. Sorry about that. Individual knowledge and skill, community education, health systems and providers, looking at coalitions and partnerships, organizational practice, and then, of course, policy and legislation. And so some of our policy points have been things like the Bold Infrastructure for Alzheimer's Act that was originally signed into law in 2018, reauthorized at the end of 2024, and provides grants to state, local, and tribal public health agencies to implement public health approaches for brain health and for awareness in Alzheimer's and other dementia. And one of the policy aspects that we do here is we continue requesting funding for these programs from the Appropriations Committee. Next slide, please. I want to also quickly talk about a bill that is looking ahead at screening and prevention, and really talking about how we can let people know that they have the disease early on in the disease. Sometimes you can find that in the blood up to 20 years before cognitive impairment happens. And so we're looking to get screening tests covered by Medicare. This would allow Medicare to cover them. It doesn't require Medicare to cover them. It still lets Medicare run their own evidence-based process. But by doing so, if people find out earlier, they can make some of these lifestyle modifications. They can make these changes to potentially reduce the chances of cognitive decline. So on the next slide, you'll see sort of why we're here and why we're doing this. We know that 4 in 5 Americans consider early diagnosis very important. We know that they would want to know if they had Alzheimer's before symptoms appear or before it begins to affect their daily activities. And we know that 9 in 10 Americans would want a simple test to allow for early treatment. And I realize I keep saying we know. This comes from our facts and figures last year, from our special report last year around early detection. And next slide. We really believe that we're at this sort of mammogram moment for Alzheimer's disease. These brain changes can begin up to 20 years before symptoms start. And Medicare is not allowed to cover screening tests. By law, they just can't unless one of 2 things happens. 1, Congress gives permission via statute change, or 2, the U.S. Preventive Services Task Force makes a recommendation. Now that one can take a long time, and right now the USPSTF is kind of in flux. And so we went to Congress to ask them to put this into statute. Now they've done it before. They've done it for mammograms. They've done it for colon cancer and for pap tests and other things in the cervical cancer space. So we know they've done it before, and we also know that earlier detection leads to better outcomes. It allows people this opportunity to, like I said, implement modifications, lifestyle modifications to better their brain health. So now we need Medicare to give the green light for Alzheimer's and dementia screening tests. And the way we do that is through the Alzheimer's Screening and Prevention Act, or the ASAP Act. And on the next slide, you can see a take action option where you just let your members of Congress know that you support this. We currently have 157 co-sponsors in the House, and I believe we're around the 40 mark in the Senate. And so, it's clear that this is a bipartisan effort to really take Alzheimer's and dementia seriously and to really help keep people's brains healthy as long as possible. So with that, I will pause and turn it back to Christine. Thank you so much.
Thank you, Ms. Falak, for your presentation and also for sharing such an informative information about Alzheimer's and brain health, and also about the ASAP Act. So as we close the panel session, we thank each of our speakers once again for making today's webinar such an informed discussion. And now that we have had all of our final speakers, we will move on to the question and answer session with all the panelists. And we have several questions from the audience, and I will start with the first one. And this can be answered by all the panelists. So from your perspective, what is the most important for people to know about brain health today?
I can start. I mean, I think I'd say that the most important the first thing is that you don't have to wait to be older or to be experiencing cognition issues in order to take action. That you can do this at any age, and that there's all sorts of things you can do to decrease your risk of developing dementia later in life, or and just help you be as healthy as you possibly can in order to spend time with friends, family, and doing the things you love. You have the ability to take your health into your own hands when it comes to brain health. So I think that would be my key message.
Thank you, Dr. Rodriguez. And also the importance of staying active.
Yeah.
Hugely important too. Anyone else?
I think brain health begins early. So it's something that, you can teach your kids now, you can teach your grandchildren, you can talk about the different ways that you can protect your brain and that you can support your brain starting early, and that it's never too late to start taking care of your brain.
Excellent. I agree too, Ms. Polak. So we have another question, and it's about what role do community programs and resources play in improving brain health awareness and care? I can repeat that again. It is about what role do community programs and resources play in improving brain health awareness and care?
I can start by just repeating something that I mentioned. They are key. The community programs, or the community partners, the senior centers, everybody that it actually gets to work with older adults or adults in general, they play a key role in communicating the information, educating the community, providing the resources needed to take action and everything. So as I mentioned in my presentation, everything that we are able to do is because those partnerships, they are the ones that actually invited us to present. They are the ones that actually refer patients. They are the ones that are always there for the community. So it's the link between the scientists, the providers, the resources. So they are very important.
And I would just add that in my presentation, I talked a lot about trust, and community-based organizations are often the first trusted point of contact for a lot of our communities, especially when there's been a historical experience or a historical barrier to healthcare. And while healthcare systems can diagnose and treat disease, our community-based organizations can create the conditions that promote brain health through different programs and activities. They can facilitate early recognition of cognitive changes and do the service connection between individual and other resources. They can also do a lot around reducing stigma. So they're really critical in this work.
I'll also
Thank
add that, not all communities have the same access or the same resources available to them. Even just in things like access to healthy foods, safe places for people to do exercise, community centers for seniors to congregate or for older adults to come together. And so community organizations play a key role in facilitating a lot of that and being able to provide access, and to help even the playing field for people so they can have access to the things that they need for their health.
Excellent. And also, I want to add the importance of also engaging with promotoras de salud, or also known as community health workers. They're trusted members in their communities. Well, again, they know about a certain topic, about diabetes, for example, or Alzheimer's, brain health. And they go to their community and provide that information in culturally and linguistically appropriate manners or materials for their community to understand, and also answer any other questions that they might have and might be scared, for instance, to go to the doctor or go ask another person instead of the promotora de salud or community health worker. And Dr. Quiroz, we had a specific question for you, and this is about the BLAST study that you mentioned. And one of the questions is, how long will the BLAST study go? And also, they have another question about, have you developed brain health materials in Spanish that can be shared?
So I will start with the last one. Yes, so we have a materials that we have developed, and we'll be happy to share that, and we can send it to Christine, and you can help us with that. So yeah, so like anything that we can share, it will be great. So as I would say in the presentation for BLAST or the Latino study, like the only thing that is required is the one assessment, as I mentioned, the cognitive assessment and what we call the cognitive screening. And after that, every participant has the choice to complete all other procedures and stay with us for like 3-5 years for follow-up if they want to be continue to be followed up every 18 months. So it's completely up to you. Like, but the required is only one session, that is the cognitive screening.
Thank you, Dr. Quiroz. And due to the time constraints, I have another question, a final one, and it's for all of you. And it's, if you could share one key message with families today, what will be?
I can start. I think that there's a lot of hope in Alzheimer's and dementia right now. There's a lot of incredible research happening. There's a lot of people who are working to solve this crisis, and I think there's a lot of hope. We also have there are a lot of people who, just listening to some of the other speakers who are there to break the stigma and to have the conversations with families and to help support families. And so I think, it's a really hard disease. It's a really hard place to be, but there's a lot of hope right now.
No, please go ahead.
I was going to say that I personally love what Christina mentioned, or normalizing the conversations with our family about these issues. And I think that this, like, especially for the Latinos, we know that something that we share is that we care about the families and we actually care about our parents. So I mean, like, starting those conversations as early as possible, like during lunch, dinner, you're with them. I think that is key, and that's going to have a big impact. Is you just normalize it, and it's part of the conversation. So thank you for that, Christine. I think that it was very good.
I was going to say the same thing. I was going to echo Christina's sentiments that I think having that difficult conversation with family, especially as you're noticing things that, as Jennifer also said, like it's never too late to start. And so I think it's having those clear, open conversations amongst family, with friends, whoever's involved in the care and support of people is really important.
And I think I would just add that also kind of, reiterates what my other co-panelists said, is that taking care of your brain is just as important as taking care of your heart. And a lot of the things that you do for your heart help your brain. So we often only talk about brain health after someone develops memory problems, but our brain benefits from all of those healthy habits that we can engage in throughout our lives. So going for walks, eating good food, staying connected with friends and family, sleep. That's something I need to work on for myself. So all of those things can really help your brain just as it can help your overall health.
Perfect. Thank you all so much. And also, I have a final one, I promise. And it comes up from a participant that just mentioned the importance about culturally adapted assessment for our community, for the Latino community. And just she wanted to ask about if you, some of you, right? I believe all of you have developed some culturally adapted assessment for the Latino community. If not, just to also be aware of it. So,
That,
well, yeah,
that's a
go
big
ahead.
part of what we do in the lab. So yeah, so we have several cognitive measures that we have developed, particularly for the Spanish speakers and the Portuguese speakers, Latinos. So yeah, so I just want to mention that.
Thank you, Dr. Quiroz. So before ending today's webinar, I would like to introduce Dr. Carl Hill, the Chief Diversity, Equity, and Inclusion Officer for the Alzheimer's Association. So Dr. Hill oversees strategic initiatives to strengthen the Alzheimer's Association outreach to all populations and to provide communities with the resources and support necessary to address the Alzheimer's crisis. So today, Dr. Hill will provide us with closing remarks. Welcome, Dr.
Oh,
Hill.
thank you so much, Christine. And this has just been a wonderful conversation. Happy Alzheimer's and Brain Awareness Month. Really just enjoyed hearing from Dr. Rodriguez, Dr. Quiroz, Ms. Pacheco, and of course my colleague, Jennifer Pollock, who does just excellent work at the Alzheimer's Association around policy and at the intersection of policy and health equity. We at the Alzheimer's Association, we believe that certainly engaging diverse perspectives is critical to achieving health equity, meaning that all communities have a fair and just opportunity for early diagnosis and access to risk reduction and quality care. We know Hispanic and Latino communities are disproportionately impacted by Alzheimer's and other dementia, and yet are less likely, as mentioned here today, less likely to be diagnosed, less likely to be recruited to participate in research, and certainly less likely to have important culturally relevant access to care and support services. And frankly, this is unacceptable, and it has to change. And so we at the association are leading the way, certainly by developing strategic partnerships. We're so honored to work with the National Hispanic Council on Aging, with Dr. Cruz and you, Christine, and the entire staff with these partnerships to create pathways, for greater health equity, mission engagement, and inclusion for everyone. At the association, we're hoping to work with partners to build cultures, of understanding, belonging, and pursuing diversity, equity, and inclusion through education and policies. And so the Alzheimer's Association is certainly committed to doing all that we can to provide all communities with important resources and education to realize our vision of a world without Alzheimer's and all other dementia, all other dementia. And so, certainly want to, thank all of the panelists who, shared their expertise, their experiences, their commitment to improving brain health in Hispanic and Latino communities. One message has come through, really clearly today, and that is, brain health is not just a medical issue, right? It's a family issue. It's a community issue. It's a matter of health equity. And so our cultures, certainly teach us the importance of caring for one another across generations, and that same spirit, I tell you, must guide our efforts to promote brain health and address Alzheimer's and other dementias. We also know that knowledge is empowering. By increasing awareness, encouraging conversations about cognitive health, expanding access to detection and quality care, and investing in research, continuing to invest in research that reflects the diversity of our communities, we can help more individuals, more families receive the support that they need and deserve. And so the work ahead belongs to all of us: healthcare providers, researchers, community leaders, advocates, policymakers, and families. Together, I tell you, we can reduce stigma, we can build trust, and ensure that every person, regardless of language, culture, or background, has the opportunity to age with dignity and maintain the best brain health possible. So thank you for allowing me to be a part of this discussion. I hope you leave today not only better informed, but certainly inspired to be a part of the change in our pursuit of health equity. And I'll turn it back over to you, Christine. Thank you, everyone.
Thank you, Dr. Hill, for your valuable experience and perspective on this important issue. So we would like to thank all of our attendees and experts for joining today's virtual event. And before closing this event, we invite you to join a growing movement of individuals dedicated to improving the lives of older adults, their families, and caregivers through our individual membership program. So for just $25 a year, members gain access to exclusive resources, educational workshops, advocacy tools, and bilingual information on health and aging, all while directly supporting NHCOA's mission to uplift and also empower our community. To learn more or become a member today, you can scan the QR code that appears on your screen. And today's webinar recording will be available on NHCOA's YouTube channel. And we encourage you all to follow us on NHCOA's social media channels such as X, Facebook, and Instagram by using @NHCOA for more information and news of upcoming events. So thank you again, and until the next one. Bye-bye.